Sometimes the hardest part of a wellness journey is taking the first step, but you don't have to take it alone. That's a reminder from the Living to Serve Foundation. They're getting ready to kick off their Survive and Thrive program, and Janice Parker and Rhonda Guyton are here with all of the details. Welcome, ladies.
Thank you.
Oh, look at that in unison. That was cute. Thank you for coming. So let's talk about the Living to Serve Foundation.
Well, Living to Serve Foundation was started when I first got diagnosed with breast cancer, and our goal is to provide programming resources and education for our community, and every dollar that is raised goes back into the community. We are 100% funded by the community, and everything stays local.
Absolutely, and you're definitely doing that with this upcoming program, Survive and Thrive. So tell us a little bit about the program and why it's important to provide that resource to the community.
Sure. The Survive and Thrive is our wellness journey, our 6-week holistic wellness journey in collaboration with Carle Health. It is a program that Rhonda and I brainstormed about because as being breast cancer survivors, both of us diagnosed twice, we know that there is life beyond cancer, right? There's life beyond the diagnosis. So, and it's a holistic approach, your mind, your body, and your spirit. So this program is to help people to get peer support, accountability, the education, and all the resources that they need. And each session builds on top of each other. So we are excited about this new opportunity.
And speaking of the sessions, what can people expect to learn over the course of the 6 weeks?
So September 30th is our kickoff. We want you to come, get some information. We're so excited. So we'd love to see you at 5:30. Then the second week, we're going to be talking about mental health because we know that this journey takes its toll on you. Then we have nutrition in collaboration with Hy-Vee. Thank you, Hy-Vee. We've got yoga with Alicia Wyatt. If you were at Sisters Rock, you already know you got something good coming. And then we're going to be talking about navigating the healthcare system. That is so important because there's so many things that we don't know. And then at the end, we've got our community communication. So those who qualify will be able to get their mammograms for free, because one of the things that we also do with Living to Serve is we provide free mammograms for those who are underserved and not insured. So you can get your mammogram for free. If you miss a session, that's fine, even though it's building us. We want you to come, and we want you to register at livingtoservefoundation.com, and we want you to show up at Carle North, 2338 West Van Winkle Way in Peoria.
Oh, you gave us so much information. Hopefully everybody got it. I absolutely love it. So with you both being survivors, I'm sure you have undergone something similar, right, now that you're offering it to other people. So how impactful was it to go through this experience and have this level of support for yourself that now you want to provide for others?
That is the exact reason. We know that women who are educated and provided the right resources are better for our community. When Rhonda and I were going through, we pulled off of each other. We've created a network of women that are educated in this field, that support us, gives us accountability, and reminds us that this journey is not over, right? Yeah. And that you have people here to support you. So we want to provide that same thing to individuals as well.
Yeah, and it's not just for survivors, right?
No, not at all.
This is for every woman in the community, because there's so much information you need to know, because you have co-survivors. And then there's sometimes just things that you don't know about. A lot of people don't know about the different grants that could be available, not just for cancer, but for other ailments that may be going on in your life. I mentioned before about one of my chemo drugs is almost $16,000 a month. I didn't know about that CVS program, right? So this is an opportunity to learn about that. So it may not be just for breast cancer, it could be for heart disease, congestive heart failure, so many different things that are affecting our lives daily.
And really quickly, you said co-survivor. What do you mean by that?
So, you know, you have your spouses, you have your best friends, you have your sorority sisters that help you in this journey. And they are dealing with some of the same things that you're dealing with. They're helping you to survive, and we need them to feel welcomed and thanked for the work that they're doing for helping us through this journey.
Definitely something we want people to take advantage of. Thank you so much for providing this resource to them.
Thank you for having us, and thank you for the opportunity.
Yes, absolutely.
Miss Janice, Miss Rhonda, it was a pleasure.
Thank you.
All right, if you or someone you know would like to join us here on In the Know, just head to our website, 25newshour.com. You want to follow the features tab to In the Know, and that's where you can submit the form.